Marcella Nunez Smith. I'm currently co-chairing the advisory board on COVID-19 for the Biden-Harris transition, and will be leading an equity task force in the White House in the new administration. I'm also a faculty member at Yale University.
Thank you, Dr. Nunez Smith, for joining us on this special edition of the Solace virtual series, Mental Health. In a recent speech after President-elect Joe Biden announced that he would be a co-chair on his COVID-19 advisory board, you touched on the complexities that minority communities face in the healthcare system. Can you share some of your major factors that impact minority care and the outcomes?
Well, thank you so much for the invitation to be with you today and for having this conversation and raising these issues. And it is certainly a great privilege for me to serve as this inaugural chair for a newly formed equity task force in the White House. That is certainly a role that has not existed before in our country. And I think it really symbolizes and reflects the need for urgency in how we think about the health of marginalized communities. We know that the issue is not one of genetics. What we see is a legacy of really intergenerational and structural limits in access to resource. And so that expresses itself through things like safe environments to exercise, or availability of food, or quite frankly, limited access to high quality healthcare.
And how does your cultural background as a native of the US Virgin Islands impact your equity work and inform your role on the COVID-19 advisory board?
Thank you so much. Yes, I'm very much a proud Virgin Islander. And, I think, we all bring our culture and our perspectives to everything, and certainly to our work. Growing up, my grandmother would always say, remember, you're no better than anyone else, and no one else is better than you. And I think that that was actually a foundation for the view of equity, right? That we should be thinking in that way together, and that's the best way to move forward. And so, I think of that as some of the cultural relevance that I grew up with, that we do think about our neighbor, we do care about how others are doing, and we will make choices and sacrifice for the greater good.
Dr. Nunez Smith, the US is leading in new COVID-19 cases. However, that a vaccine has been most recently green-lighted. What specific timelines should the American people be aware of?
Yeah, I think there are certainly causes for hope for us now. We are setting really troubling milestones every day, and so we can't lose sight of that. But it is true that there are vaccine candidates on the horizon. Even as we speak, the Pfizer vaccine candidate is moving through the emergency use authorization process. And that's an important first step. I think, as far as people in the United States considering when they might get vaccinated, we have many more questions. We are still in the transition period, and for us on the advisory board, it is a matter of still sorting through information about things like vaccine supply, manufacturing, and distribution. This is just critical information that we need in order to understand what timelines might look like for the general public.
What is the future focus and plan on eradicating the virus, and can you touch on any long-term prevention details?
I think we all need to be very unified in fighting the virus. It has unfortunately been highly politicized. The Biden-Harris administration is leading with science and evidence and data in this work. Eradication you know, that is still an open question, but we certainly know that there are strategies that we can use that reduce the spread. And so we must recommit. The president-elect has asked us, right, for 100 days after he's taken office to continue to wear masks. We must continue to limit our social gatherings, wash hands, make those choices. That is part of getting control of the virus. And I think that's what we're trying to do. Vaccines are one strategy. We need to boost our testing as another strategy and support people who might need help to isolate and quarantine. I mean, these are the important strategies we have. And if we use these, we can get to reopen schools and reopened economies safely.
Finally, this conversation is part of the Solace virtual series on mental health. What message of encouragement do you have for people who are trying their best to keep it together in the midst of this pandemic?
I'm really grateful that you're focusing on mental health. I think that is just an under-recognized part of our conversation during the pandemic. I think it is about finding these moments of gratitude and leaning into hope and light and optimism. We must have these conversations publicly. We must move away from stigma having to do with mental health. People are really suffering, but there is a new day and a new dawn. We will get there together to tomorrow and our new normal. So keep the faith.
Awesome. So I want to thank you for joining us today. As a fellow Virgin Islander, I think I speak on behalf of everybody of the territories of the U.S. Virgin Islands and say
Thank you.
congratulations and much success in your future. And we look forward to the work that you have already started and the work that you will continue
I
to do.
really appreciate it.
Thank you for joining us. Oh, thank you for joining us, Dr. Nunez Smith, and much success. And back to you, Melissa.